The ripple effect of the ongoing strike by health workers continues to grow, the strike now stretching the already strained resources of the country's largest referral hospital, the Kenyatta National Hospital. The hospital's maternity ward has a capacity of 150 patients, but owing to the strike, it is now holding 334 patients. And while the labor ward has a capacity of 35 patients, it has currently admitted 112 patients.
We've gone ahead and called from leave all the employees of the national government working in the sector, and also requested that if there are emergencies, patients can be taken to faith-based hospitals and also to private hospitals.
The government now committing to set aside additional funding for referral hospitals to open more emergency wings so as to manage what is quickly becoming a health crisis.
We have written to all our interns to tell them, look, they are not part of this strike, because to them they are not yet deployed in the counties.
Vital services at county hospitals, emergency wings, outpatient and ICU facilities continue to be paralyzed. A looming deterioration in the medical sector, what would see many more patients suffer.
Mama hajahudumiwa, hakuna dawa yenye amemeza tangu alale kwa kitanda.
Tunaenda nyumbani leo na daktari ajaandikia sisi dawa na mama ajiwezi hata kuamka.
Wagonjwa wengi wanaenda Tanzania. Sasa sijui tuko Tanzania, tuko Kenya, hata sisi tunashangaa, hata saa hii tunataka kuchukua mgonjwa hapa tupeleke Tanzania.
We are taking 100 nurses, CEOs at probably 1,000 shillings per person per day. At 150 we should pay 150,000 per day, but we do not know for how long.
Efforts by the government to broker a return-to-work formula appear to have failed, with the health workers unrelenting in their demands.
What we are demanding is very simple. Reverse devolution of personal emoluments and give a clear roadmap to the establishment of a health services commission.
Such are the concerns of health workers across the country, concerns they say the government has continued to turn a blind eye to. Central government and county government's representatives had on Monday proposed the national government continues managing the health workers' salaries until February 2014.
We insist they peg the timeline of retention of centralized pay of emoluments to a point when all the documents are ready.
Health workers are adamant that the government must first provide for a law to anchor devolution of services.
That legislation is in place, which is the Transition to Devolved Government Act. That is the reference that was made for in the Constitution about devolution. That's the only legislation that's supposed to be in place for you to be able to transition to devolved government. And that has already happened.
As it stands, the High Court has issued orders to stop health workers from continuing with the strike until the hearing of the case filed by the Ministry of Health is heard on 16th December 2013. Sally Mbilu, Citizen, live at 9.